Hello and welcome to the Microsoft Health Common User Interface Patient Journey Demonstrator. The Demonstrator provides exemplar implementations of Microsoft Health CUI guidance as well as being a showcase for new ideas, experimentation, and an artifact for learning and thinking about future developments for the program. You can find out more about the Microsoft Health Common User Interface program at www.mscui.net, as well as download design guidance and controls free of charge for building next-generation healthcare applications. Much of the guidance and controls available feature in this demonstrator. The demonstrator is built in Silverlight 2, Microsoft's rich internet application technology, which allows us to create new ways of visualizing, understanding, and engaging with clinical data. We will now walk you through your end-to-end journey and we welcome your feedback, so please get in touch with us by emailing mscui@microsoft.com. Before starting the scenario, we would like to bring your attention to the navigation bar across the top of the application. This bar tells you about the screen you are currently on and gives some context from the scenario itself. A panel slides out which allows you to jump to various points in the application. The Show Guide button at the top right of the screen presents overlays, highlighting where we have used Microsoft Health Common User Interface guidance and controls, as well as give you some tips about what you can do on this screen. The Scene Details tab gives you more information about the context of this scene and lists the patient safety principles addressed. Our scenario starts at a local doctor's surgery. We are looking at the surgery administrator's screen. The admin has a number of task-related panels allowing her to schedule appointments, check email, register patients, and look at repeat prescription requests. The screen is configurable, allowing the administrator to lay out the panels as she pleases. Expand a panel to see more information, and switch between panels. The schedules offer a collapsed layout, giving an at-a-glance view of how busy a doctor's day is and when they have availability. Each hour can then be expanded for a more detailed view. Patients can be easily moved between schedules using drag and drop. As the surgery opens for the day, the administrator receives a phone call from a patient, Mr. Brian Johnson, complaining of chest pain. The administrator searches for Brian and confirms some further details on the phone with him to be sure that she has the correct record. Once she is certain, she schedules an appointment to see one of the surgery's doctors, Dr. Cox, at 8:50 a.m. She then clears the search and moves on to her next task. We now move on to Dr. Cox's screen at the start of Brian's appointment. The doctor's screen contains a number of task-related panels, similar to the surgery administrator's. There are some additional panels too, including a pathology report inbox, links out to various knowledge support resources, and a practice notice board, allowing the doctor to keep in touch with the surgery team. The doctor's screen is also configurable, allowing the layout to be changed and panels to be expanded and collapsed. The patient, Brian Johnson, has just walked into the doctor's office, so the doctor opens Brian's record by double-clicking on his name in the schedule. The patient record view provides high-level, up-to-date information about the patient in a number of panels. Across the top of the screen, there is a patient banner, allowing the doctor to correctly identify the patient. There is also a list of recent activities and consultations, a list of the medications currently being taken, a chart showing the recent blood pressure readings, information about the patient's allergies, lifestyle, and who is currently caring for them. The doctor starts by looking at the medications Brian is currently on. Each panel can be expanded by clicking on the box in the top right-hand corner. The medications list view allows flexibility and customization of the information. We can switch between current and past medications, group by different fields like prescriber, or reason for taking the medication. The level of detail can also be increased and decreased as required. Each column can be resized and sorted on. The doctor can see that last year the patient started taking some medication to help with essential hypertension. The doctor then expands the most recent activities panels, which shows a list of contacts made with the patient. Each item in the list is expandable, showing more information about that consultation. The doctor can see a number of essential hypertension-related consultations and wants to look at Brian's progress over time. He first groups the items by problem. The detail slider allows him to control the level of detail on the screen. Taking the 3 most recent essential hypertension consultations, the doctor drags them over to the comparison dock. He then expands the dock, allowing a side-by-side comparison. Expanding the examination section allows the doctor to see how Brian's blood pressure has changed over time. He can expand other sections for further investigation. Finally, to help confirm the diagnosis and bring all of the information together, the doctor expands the patient charts panel. The patient charts panel allows the overlaying of various datasets, giving a rich picture of a patient's progress over time. Here we can currently see the patient's blood pressure. The doctor can use the time slider along the bottom to move backwards and forwards, expand and compress time. Adding additional charts by dragging them from the list on the left-hand side, such as creatinine and cholesterol, shows that data overlaid. The stacking order of the charts can also be altered, changing which chart sits at the front. The doctor adds medications to the chart and zooms into a spike in Brian's blood pressure and creatinine that occurred last year. He can immediately see a change in Brian's medication caused his creatinine to rise suddenly, and this explains why he was taken off the course and placed onto a new medication. All of the information is also available in a table format. This still responds to the time slider and changes in the list of charts. The doctor decides that Brian needs to go to the hospital for an exercise test where his heart can be observed. He suspects that an angiogram may then be required. To finish the consultation, the doctor clicks on the menu button and then New Consultation to add notes to Brian's record. A form appears and the doctor can start adding information. The form uses SNOMED CT provided by Health Language for encoding clinical information. This allows the doctor to provide very concise, coded notes on the patient that significantly reduce the risk of misinterpretation. The doctor types chest pain in the problem box. This searches for clinical terms and returns a list of possibilities. The doctor picks the correct term from the list. When the doctor selects chest pain, a list of examinations related to chest pain are instantly brought back. The doctor clicks to expand the history section and add some information about Brian's history. When the doctor clicks Find Matches, the text entered is searched for clinical terms and highlights words and phrases that the doctor can encode. The doctor clicks on Hypertension and a pop-up appears below allowing further refinement. A few options are available for finding the correct term. The nearest matching term is shown at the top. Clicking on Nearest Matches shows terms that start with the word originally typed in. All matches show